Here's a quick example on how to code a patient with a certain condition. So we'll take up a test patient here under my name, Sean. This will be a blank patient here. So let's say this patient comes into you for the first time. You see them in their consultation, and you give them a repeat script for the regular medication. Let's say Now let's say you write an uncoded note. So lots of uncoded notes will be written in consultations every day. But let's say you come back to this patient chart, or afterwards you say you want to code them with a certain disease or condition. You click on either of these two buttons here. So here's ICPC2 and ICD-10. They're essentially two different coding systems. You use whichever one you want. I tend to use ICPC2 the most. So you just click on this little dotted box here, and you'll get a search box. So if you type in, say we want to, let's say this patient has atrial fibrillation, high blood pressure and diabetes. So you have to code each of them. It's pretty simple to do. Just type in diabetes, and they give you an option here of different types of diabetes. Let's say they're non-insulin dependent. Double click on that. Over here on the right hand side, before you click save, it'll give you an option of whether you want to tag that as part of their past history, their family history, their active history, their social history, or if it's a private note that you don't want anybody else to see. So diabetes non-insulin dependent is what I want to code them with. It's an ongoing active condition, so I click it as active, and you'll see that it'll be added in here as a condition. If you go to the overview of that patient, you'll see an active diagnosis here. Diabetes non-insulin dependent will be put in. But this patient has other conditions as well, so let's say they have hypertension, HYP, or so let's pull them up here. So let's say they have uncomplicated hypertension. Again, that's an active disease code. And let's say they also have, let's say they have atrial fibrillation. Let's say atrial fibrillation, but let's say they had that in the past, but now it's gone. So click, let's say they're resolved and back in sinus. So you click that in past history. So that might be the way you decide to code it in your practice. So if you go back to consultation details, then you'll see hypertension uncomplicated and diabetes will come up as an active condition. Atrial fibrillation then will come up in the past history. And that's how you code chronic diseases. If you, let's say you didn't want to use ICPC2, let's say you want to use ICD-10, you could do that as well. You could code them, let's say you want to code them with diabetes. Again, ICD-10 is a much more extensive database of conditions, whereas in ICPC2 you might just get two options for non-insulin or insulin dependent. You can see there's much more of a selection here in the ICD-10. So let's say you click them as non-insulin dependent. Again, active condition. You can always double code them as well. It doesn't make much of a difference, so long as they're coded in one format. And you'll see it's added here into the active diagnosis. So that's a quick overview on how to code different conditions on the Socrates platform.